evening. Thank you very much for joining us here on Mirror Now. This is Urban Debate and I'm Heena Gambhir. India viewers reported its first case of Omicron on 2nd of December. Today, on 29th of December, our Omicron tally has jumped to 781 already. Delhi is at number 1 with 238 Omicron cases being reported here. Maharashtra is at number 2 with 167 cases coming so far of Omicron. Then at number 3, it is Gujarat, and then you have other states as well. Now, this variant of concern, viewers, first was detected in South Africa, has already spread to 21 states across the country. When Omicron started spreading in India, experts were of the view that this has the potential to trigger a third wave. On Urban Debate at 8 tonight, we will try to find out if the third wave, in fact, has already started. Do we need to increase our level of caution? And what more can we do to protect ourselves? Remember, the second wave began with an unprecedented spike in cases in Mumbai as well as the national capital. A similar trend, viewers, is being witnessed now as we speak. In Mumbai today, 2,510 cases were reported, which is an 82% jump over yesterday's 1,377 cases. As far as Delhi is concerned, yesterday we saw 496 new cases coming in as compared to 180 cases that were reported on 24th of December. Now, today's data is yet to arrive for the national capital. It is expected any time from now. But the positivity rate has been steadily going up. Yesterday, it was 0.89%, which was the highest in 7 months. So we will try to understand from our guest this evening, is the third wave here already? And the pictures, in fact, that we are showing you are from different parts of the national capital. Now, yellow alert is in place in the national capital, which means new restrictions have been announced by the chief minister, by the government of the national capital. But despite that, we saw crowding at different places in the national capital. So do we need to do more is what we will now try to understand. Dr. Rajneesh Kapoor, Vice Chairman, Cardiology at Medanta Hospital, is joining us on the broadcast. Dr. Rahul Pant, Director, Critical Care, Fortis Hospitals, Mumbai, who's also member National COVID-19 Task Force and Maharashtra COVID-19 Task Force, with us this evening. We have Dr. Ishwar Gilada, who is an infectious disease expert, also joining us. Dr. Sunila Garg, member Lancet Commission COVID India Task Force, also with us on Urban Debate this evening. Thank you very much, all of you, for joining us here on Mirror Now. Let me begin the discussion with you, Dr. Ishwar Gilada. Is the third wave here already? The way we are seeing a spike, not just in Omicron cases, but otherwise also if you see the COVID tally, specifically in Mumbai and in Delhi.
See, third wave is already in the beginning, and we are going to see a major spurt. Probably by 15th of January, we'll see 6 lakh cases a day, if it is doubling every 2 days. If it is doubling every 3 days, then by 26th of January, we'll see 6 lakh cases per day. People are not able to understand that. I don't know whether they have forgotten the whole tragedy of their near and dear one dying during the second wave. They have not seen, they are not just giving any heed to the oxygen shortage at that time, bed shortage at that time. And on the other hand, we are seeing that there is a doctor strike going on. The doctors are not recruited for 8 months. That means there is a shortage of 1 lakh doctors, which are of junior resident cadre. And they are the doctors who run the hospitals in all medical colleges. So under this situation, we are going to have a major problem. Lethality may be low, virulence may be low, but again, that cannot be decided, because if you, no two waves can be compared, no two countries can be compared, no 2 times can be compared. You look at UK, death rate is very low. You look at neighboring France, death rate is 10 to 20 times more than UK. You look at Russia, the 25 to 30 times more death rate there. You look at USA, daily 2,000 people are being lost. So currently, what you see currently, whatever numbers are going up, they are not Delta, they are purely Omicron. And within a week or 10 days, Omicron will replace Delta. So when Omicron replaces Delta, there will be no need of doing your genome sequencing. All will be Omicron. So we need to understand this thing. And on one hand, there are double standards. On one hand, we have restriction for common people. On the other hand, the election rallies are going on. Big gatherings are going on. ceremonies are going on. So I think people should understand, start taking onus on their own. Don't expect authorities to be very strict. Authorities take a kind of an extreme decision or even a lockdown decision, which are administrative lockdown, based on people's behavior. If people behave properly, they don't need to step in at all.
Okay, so people need to be extremely cautious, but what you're telling us, sir, is something that we really need to pay attention to. You're saying that, the way cases are rising, we could actually see about 6 lakh cases coming, in a single day. So we all really need to be extremely cautious, even though there are some restrictions that have been announced by various state governments, but we need to be extra cautious as well. Dr. Rajneesh Kapoor, what more can we do, and what is your assessment of the way the cases are rising?
Yeah, so I think we are heading towards a third wave. This is nothing but a third wave, and we are anticipating that cases are going to rise the way it is happening. We always follow the trend of UK and US by a gap of say 6 to 8 weeks, and that is what actually is happening again. US and UK, they are having more than 1 lakh cases per day, and so is the case would be in India in next 2 to 3 weeks or 4 weeks maximum. So Omicron is a highly transmissible virus and it is in the air. The problem is there still would be many cases who are COVID infected with Omicron virus, but they are asymptomatic. This was not the case prior with the Delta virus. So the asymptomatic cases who are actually revolving in the society are the biggest carriers and biggest spreaders for a new wave to be, propagating in the society. So we have to be cautious. We have to be very, very particular about restricting all the get-togethers. And I think my friend just mentioned about the election rallies. So this is very paradoxical. On one side, we are saying that New Year get-togethers are to be restricted, but on the other side, see the UP election rallies. They actually turn out to be very big spreaders for COVID infection and could be a potential trigger for third wave. So we have to be extra cautious with all the warnings and all the policies of restricting the get-togethers, wearing masks and social distancing, and scaling up further the testings and genetic sequencing at the moment is highly required. But then once the cases scale up very high, then obviously genetic sequencing may not mean anything. And once we are thinking and anticipating that cases are going to be very high, there is no question. We again will be loaded with, the cases in the hospitals. Hospital ICUs will start getting clogged. However, I can't say whether it would be the similar situation of oxygen deficiency or not, because still I'm not very clear about what could be the gravity of Omicron virus, but certainly we are heading towards a high degree of positive cases once again and hospital getting clogged once again.
Okay. What you're saying is very, very important as well. Cases could be there of Omicron, especially among patients who are asymptomatic. So that's also something that we need to pay attention to. Requesting all of you to stay on with us. In fact, as I was mentioning earlier, that Delhi's COVID data is expected to come out any moment, and we have got the data. Massive spike, viewers, in fact, has been reported in Delhi's case count. Delhi has reported 923 fresh COVID cases in a single day. Its positivity rate has touched 1.29%. This was last seen on 30th of November. So it's at a 7-month high, the positivity rate. Let's straight away go across to my colleague Alok, joining us on the broadcast for more on this. Alok, good evening. From 496 to 923 cases today. It's alarming.
Yes, absolutely. In fact, it is doubled. We can say that 100% hike in last 24 hours. So definitely it's a cause of concern for the government. Remember, Delhi government has already started taking precautionary measures, and in fact, they have already started shutting several things. And today, in fact, we are seeing on the street that there are number of vehicles are also less in comparison to earlier days. But there was a huge kiosk we saw at the railway station, bus stands, and also at the metro stations because of the long queues. And yesterday, Delhi government come out with an order of curtailing the number of people with the 50% of strength in the transport service, in the public transport services. So that is the reason. But definitely it's a high time for the people to think, and a lot of people were planning to do certain things, especially during the time of the festival and New Year. But definitely they need to take care of themselves, because this variant, whichever variant it is, it's spreading very fast, and this is the reason that we are seeing that in last 24 hours, 100% spike in the COVID cases.
All right, Alok, thank you very much for the moment for joining us with that quick update. So, Dr. Rahul Pandit, you just heard my colleague Alok giving us the information how in Delhi the case count has gone up from 496 yesterday to 923 today. In Mumbai also, we saw a massive spike from 1,377 cases till yesterday to 2,510 cases coming in a single day. Your thoughts, how alarming is the situation?
Good evening. The way the cases are doubling up within a couple of days' time, all the characteristics point out towards the large Omicron cases going up. So currently we may have a mixture of Omicron as well as Delta, but I agree with Dr. Gilada that in a few weeks' time, maybe we will probably replace the Delta entirely with Omicron, which is what we have seen across the country. And the cases could touch to 5 lakhs, 6 lakhs. I think the prediction models are there. But what we need to understand is we should not be speculating about what happens in the future. Rather, we actually look at our own backyard in the last 12 months, what has gone through, and we plan our future accordingly. So it would be very nice to have a very mild disease with no hospitalizations and no fatalities. That would be very nice to have. But we should remember that no two countries are same. No two viruses can behave in the same population in the same way. So we need to be prepared for all eventualities. And that would mean that we will actually have to be up on our toes completely from now. Prepare for any hospitalizations if they are coming up. Hospitalizations tend to follow around 2 weeks down the track from the cases when they start rising. So it's still too early to say whether we will actually have hospitalizations or not. The third point to understand is that even if we say that it's going to be a small fraction of people who will get admitted, a large number which will come positive, a small fraction of that large number will still be a very large number. And unfortunately, what's been seen in Omicron is that even with vaccinated people, even people who've had COVID-19 before, we are seeing breakthrough infections across the world. And I believe in India, we will have it won't be any different, because whatever Omicron cases we have now diagnosed with genome sequencing, a large percentage of them are actually doubly vaccinated already. So people need to understand and have two words. I've been using these two words since morning: self-restraint and self-discipline. I think we need to restrain ourselves from going out unnecessarily. We need to restrain ourselves from congregating into crowded places. And we need to have a very, very high level of self-discipline with our masking, with our air ventilation in closed spaces, as well as there should be no doubt about vaccine in anybody's mind. Every single individual in the country who is eligible right now should take the vaccine. I think it's high time people need to realize it. Otherwise, we are just going to have problem after problem, and it will become difficult for us to actually manage this whole situation.
So you've said it correctly. Self-restraint and self-discipline, that should be the mantra. Of course, the governments are announcing restrictions, but there's a lot that we as individuals will also have to do. Rightly said, Dr. Rahul Pandit. Let me now go across to Dr. Sunila Garg as well. Dr. Sunila Garg, I want to understand from you, as far as this current spike is concerned, are we seeing more cases today because we are testing more aggressively, which probably wasn't the case till Omicron had not, made its entry into the country?
Not hear you correctly because I'm hearing two channels together. Yeah, so I cannot hear correctly.
Okay. Ma'am, we will just quickly get that fixed for you. Let me take that question. Yeah, let me quickly get that fixed for you, ma'am. And let me take that question across to Dr. Ishwar Gilada. Then I'll come back to Dr. Sunila Garg. Dr. Gilada, now, is it because we are testing more people, our, testing strategy has become more aggressive that we are seeing this spike in, cases that is being reported right now?
No, Heena, parameter is not only testing. Parameter is hospitalization. Parameter is people reporting with infections. You talk to any hospital, particularly in city of Mumbai or Delhi, they are seeing double or triple the cases what they were seeing about a week before. So there are clinical cases. Secondly, whatever testing you are doing, they are not going to exponentially rise like this. They are seen like that. And we are seeing genome sequencing, which usually take 2 to 3 days time. So many of them are coming positive. So at this time, we should also adopt a policy of doing a different RT-PCR, which is not available in India. It has to be imported, but it is not very expensive as much as in genome sequencing, which is costing 5,000 rupees per patient. That test is called only 180 rupees per patient or 200 rupees per patient. And that is S-gene drop test. And if S-gene is dropped, that is a proxy marker of Omicron. So I think our capacity of testing for genome sequencing is at limited places. Numbers are limited. Cost is very high. So we cannot do a lot of genome sequencing at all. So I think testing is not done so much. Actually, if testing is done, we'll find many more positive. So what we are seeing Omicron is basically it is a tip of the iceberg. It could be 4 to 5 times more than that right now.
Okay, so you're saying that a different test needs to be done. Should government, what can government really do so that we have this test here in India?
Maharashtra government has already done that. Maharashtra government has imported that kit that is available, made available to all the districts, and Dr. Rahul Pandit will be able to throw more light because he is on the task force.
Okay, Dr. Rahul Pandit,
Rahul.
will you like to add to this?
Yes, so one of the characteristics, as Dr. Gilada just mentioned, of Omicron variant is that when we test the three genes, the N gene, the ORF gene, and the S gene, there is a conspicuous drop of the S gene. So if you test for all three genes in the kit on RT-PCR, and if there is the S gene dropout, you will be almost certain that this is going to be Omicron. So Maharashtra government has made this compulsory. However, I must say that not all labs have gone and got up those kits, but we are working on that, and I think that is something which actually will help us to understand. So what's happening right now is that the EPID cell from Mumbai, the EPID cell from the other cities actually calls up the labs and asks them to test for the S gene as well. And if the S gene dropout is there, that sample is automatically considered to be a possible Omicron and then sent for genome sequencing. But very soon we may not need to do that. And I think a simple test which would save a lot of money for us should be adopted across the country is what I firmly believe. And I agree with Dr. Gilada on that.
Okay, Dr. Rajneesh Kapoor, now I want to understand from you if there has been a significant increase in the number of people who are coming to the hospitals because of Omicron concern. Can you tell us how the situation is in the hospital?
Yes, surely. So I think in last 10 days, we have seen this change happening, that number of patients coming to the hospital with respiratory symptoms, and also they are COVID positive now. In our hospital specifically, there are around 15 admissions already. The ICU admissions are scaling up, and these are all COVID positive cases. Although the genetic sequencing for Omicron has been done in few, so 3 or 4 are Omicron positive, and in those specific cases, there has been a travel history. So things are happening. I think now only thing which I think is a light in this tunnel is that we are better prepared because of a devastating second wave. We have more SOPs in place. Already yesterday Delhi had 500 cases of Omicron and few more cases positive, and still there is a yellow alert. All the gatherings have been restricted. So that way I think are looking at the condition in a better way to better manage it. So in that context, yes, we may handle this third wave in a better sense with the better policies. like, monoclonal antibodies are available. So in all these 15 cases who are admitted to ICU, 90% of the cases are where we have done a monoclonal antibody, given a monoclonal antibody to a patient, which neutralizes the gravity of infection, and it then remains only a mild COVID infection, and patient comes out of this COVID in a smooth manner. So that way, I think we are better prepared, but still, that doesn't mean that we become casual in our social issues, like in markets, in get-togethers, in New Year parties. We have to be absolutely stern with these restrictions, the masking, the get-togethers, rather more stern, because Omicron is 4 to 5 times more transmissible. And in case it goes rampant, then it will be very difficult to control. The numbers would be very high, and again, the hospital clogging will be a big issue.
Okay. Dr. Rahul Pandit, two questions for you. Firstly, the same thing that I asked Dr. Rajneesh Kapoor as well. In the last few days, with the spike in COVID cases that we've seen across the country, in Delhi and Mumbai specifically, in Mumbai, in your hospital, have you seen a sudden rise in patients coming to the hospitals?
Yeah, so there is a sudden panic among people seeking opinion and help, but almost all of them are asymptomatic or mild. So they have either tested positive because somebody in the family tested positive, or they have mild symptoms and hence they got their testing done. So right now it's all fine. But what I want to just talk about is, if I may be allowed to have 1 minute, is that this third wave, a large portion of these patients are going to be very, very mildly symptomatic or asymptomatic. And the government, and we have advised this to the Maharashtra government, and I would like to say to everybody else, that we need to put a very robust home care package for these patients. And it's not package, I'm not talking about in terms of money, but in terms of what are the do's and don'ts, what are the red flags when they need to present to the hospital, how are we going to provide them some nursing help, some medical help at home, because even at home they need to be monitored. What is the self-monitoring they need to do? Because 99% of these patients, if they are going to be asymptomatic, we will not be able to admit them in COVID care centers or isolation centers. They will have to be managed at home, and home care will be the mainstay. And then the hospitals can look after the ones who are sick. Maybe 1 or 2 or 3% of the population which is positive will require hospitalization, and then even a smaller fraction will require ICU. I think a lot has not been done about home care understanding still. We are still concentrating on hospitals and COVID care centers, but I think home care is going to be the main front where we will have to put up some management plans in every state of the country.
Okay, we'll talk about this home care aspect, sir, in just a bit. But before that, another question for you, Dr. Pandit, as well as Dr. Gilada. Now, what Dr. Rajneesh Kapoor told us just now about how there is this sentiment that, the third wave due to Omicron, even if we see it's going to be milder, because the symptoms with Omicron are expected to be slightly milder, and we seem to be better prepared now to handle the third wave. Do you think this sentiment is bringing complacency among people? Because last time, when the second wave hit us, that time we didn't have the vaccination rate that we are seeing right now. There are more vaccines that are available to us. So do you think this is kind of bringing complacency among people who are fed up, who are tired of sitting in the homes and, following the COVID protocol? Dr. Rajneesh Kapoor first, and Dr. Gilada.
In a way, yes.
Dr. Kapoor?
Yeah. So this is a true statement that given the fact that Omicron could be a milder COVID thing, there will some complacency which will come into the daily routines of people, and that is quite visible. You go outside in market, nobody is actually having masks, and they are pretty casual about it. So the reason behind this is this only, that it could be a milder respiratory infection in the form of cold, or may not be any fever, some respiratory infection which is hitting somebody, but the people may not take it seriously, and that actually is a serious point. Now, if that guy is not testing himself or herself for the respiratory infection which he or she is having, that could be COVID, and that could actually be a carrier for many persons in the vicinity and spread that COVID infection very fast. So on both sides, where yes, there could be some complacency, but then we need to make aware by these programs. Please do not take even the milder form of respiratory infection in this winter lightly. Get yourself tested. This is of immense importance. Please, this message should go on, because somebody may think there is a winter setting in, and because of that I am having some cold, so it's fine. I'll wait for 3 days, 4 days, and then I'll be all right by myself. That thing may happen. Patient may be fine after 5 days, but patient may be a carrier in those 5 days. He may spread the disease to many. So do not be casual about this. Get yourself tested. This is even more important in the present era, in the present time. So this is a strong message which should be
very important. That is the reason, sir, why we are doing as well this show, to educate people, to make people aware of what the situation is and how can they really protect themselves. Dr. Gilada, yes.
Yeah, complacency is there too much. Sometimes we celebrate too fast. One month before, when I landed in Madhya Pradesh, I read about Chief Minister saying that when you land in Madhya Pradesh, you don't need to have COVID appropriate behavior. So if one upmanship is there and you feel that you are better than other states, that will create a problem. Secondly, we must understand one thing, that out of 12 crore people which are above 60 taken first dose, only 9 crore people have taken second dose. So there are 3 crore people of 60 plus has not taken second dose. Even if 10% of them are affected, that becomes 30 lakh people affected in the 60 plus category. We have 44% of population not received a single dose, which is children population. Total 140 crore doses are used in a population of 140 crore. That means totally we have only 50% of the country use one dose. So in that situation, we are going to have a major problem. Secondly, even though lethality is low, for medical profession, it is a clear principle. Chances may be least, do your best. Now, how do, as a doctor, I know that out of 1,000, 1 is going to die in Omicron and 3 are going to die, or 10 are going to die in Delta? Which is that one? For me, I have to work on all 999 patients. I cannot say that I will allow this patient to be one. So basically, and secondly, people must understand. People land up in hospital for two reasons. One is medical reason, one is a panic reason. A lot of people will land up in hospital in panic reason and they will lie there. And they will bring some antimicrobial resistance from there. We have seen yellow fungus, black fungus, lot of diabetes. So even hospital is not a good place. Even though you have a mild symptom, you don't go to hospital. And as Dr. Rahul Pant said, that kind of triaging is important. What patient can be managed on just phone line or a personal visit or at home, and who should go to hospital? So I think we should make a clear demarcation, tell people it's a time for restraint, wait for some more time, know your functions. You can have gathering only with 4 or 5 of your family members. There will be a good time to come. And we are not even seen any country spared. See, China also has Omicron, a lot of cases Omicron. So China is having such about dictatorship, vaccinating everybody with force. Still they are seeing Omicron. So Omicron, which can invade natural immunity, it can invade vaccine immunity, first dose, second dose, even booster dose. So I think we should be very particular. We cannot say that it is going to be milder only, because things can change. Maybe new variant will emerge out of this. We cannot say anything.
Absolutely. So, sir, I also want to understand from each one of you what should be the do's and don'ts. Let's begin with Dr. Rahul Pandit. You emphasize the need to have some kind of a home care package. So, I want your guidance for our viewers who are watching us right now. If they see symptoms like cold and cough, what should be the way forward? Should they get themselves tested immediately if they are feeling, cold, or there's some kind of cough?
So in a pandemic, if you have flu-like symptoms, it has to be considered that it is because of the virus which is causing the pandemic, unless proven otherwise. That's as simple as that. So what's happening, unfortunately, right now is people are also
testing. So they should get themselves tested on day one itself?
Yeah, day 1 or day 2 of symptoms, they should get themselves tested. The first thing is they should isolate themselves from in the home as to the best of their ability, and they should get tested. What is happening right now is a lot of them are doing a antigen test at home with the self test kit, and then they are not reporting. That's another problem because they are actually sitting at home and probably infecting other people at home as well as in the locality. So let's first start doing testing, reporting the test if you're doing a home test, or if you're doing a test in the lab, of course it gets reported, no doubt about that. So that's the first thing to do. The second thing to do is not to panic, but to seek a help from your doctor and make sure that whether you require to go to a hospital or not, majority of the doctors will be able to treat COVID at home in a very reasonable way. There would be some municipal corporation rules which would be put up by the respective cities, and you need to follow those to the T. There is no point in questioning them right now because, for example, I'll
Okay.
give you in Mumbai. In Mumbai, all the travelers who come positive are tested, and if they come positive, they are put in a institutional quarantine. You can argue against that or for that on a theoretical way, but that's the rule right now. So let's follow it so that it becomes easy for the authorities to
Hmm.
segregate people. So that's the only
Absolutely.
message I would like to give. Yeah.
So do not panic. Get yourself tested if you have flu-like symptoms. That's the mantra that Dr. Rahul Pandit has now given us. Dr. Rajneesh Kapoor, in case within a family, if somebody tests positive, what should be the procedure or the strategy that other members of the family should follow? Very quickly, sir.
Unmute yourself.
Yes, you
Yeah,
have to
so,
unmute
yeah,
yourself, sir.
sorry. So, very clearly, as Dr. Pandit was pointing, that one has to isolate immediately if the COVID infection has been detected in the family. Rather, it should be done more stringently as we have done in the past for COVID, in the previous COVID waves, because this is a more transmissible virus. Even if this is a milder form of disease which Omicron may give to the patient, but remember one thing, whatever disease it is giving or positivity is causing, it will be absence of duty hours for that person. And if this situation becomes more ominous and more people get trapped with this, see how it can affect the nation. There will be so much of absence from office or hospitals or all the working areas, and that will be a big task for a nation to actually comply with. So one clear thing that it should not spread in the family, a strict isolation uh, in terms of everything, in terms of the person's clothing should be washed separately and person's utensils should be handled separately. So to that tune, and the whole family should be very
Right.
particular about it. And definitely, if there is one COVID positive in the family, other family members should also go for the testing and get themselves testing, because we know it may all lead to
Okay.
asymptomatic or very mild form of disease.
Okay, last question to you, Dr. Gilada. Now, Delhi has already been put on yellow alert, and there are some specific restrictions that have come in place. Do you think these are sufficient to deal with the surge that Delhi is witnessing? Should other cities also follow suit? Should have a system like this in place?
I think restrictions should be everywhere. Delhi and Mumbai is like Munni Badnaam hai. They are always in news everywhere. But basically, India being a hero worshipping country, I would like to request with folded hands to our leader, religious leader, political leader, film leader, science leaders, sport leader, that you wear mask and it will send a good signal to everybody. There are some role models. You go to any hospital or clinic, there is masking. You go to any star hotel, there is a masking. You go to any saloon, there is a masking. So you look at this kind of role model, that how they are behaving in all 1.5 year, 2 years period. We are also tired of using masks, but we don't leave our guard down in a clinic. And that's the reason we keep on working day in and day out. So that kind of signal has to go. No letting the guard down. Have a new year very lightly. Call people, do video chatting. It's not that you are not likely to meet anybody. You will meet definitely. But if you fall sick to COVID, You will not meet anybody in life. You will be dying. So I think people should understand this thing.
All right. Thank you very much, gentlemen, all of you, for joining us here on Urban Debate on Mirror Now and telling us, the specific things that we all must follow to protect ourselves against this rise in COVID case count that we are seeing. Self-restraint, self-discipline is the need of the hour. Do not panic. If you are having any flu-like symptoms, get yourself tested. With this, we will slip into a very, very short break. On the other side, we will put the spotlight on resident doctors. Their dharna continues in the streets of the national capital. More on that coming up. Stay with us.